Endometriosis is a really common condition and affects 1 in 10 women in the UK. So that's a huge number of people who are suffering, and many of them in silence. Endometriosis is one of those conditions that's actually quite difficult to diagnose, and a lot of the symptoms may initially go ignored or may not be taken seriously enough. Some of the commonest symptoms that can occur are things like pain, so abdominal pain and cramps, in particular during a period or in the lead up to a period, and quite severe bleeding during a period or spotting in between can also be a feature. Quite typically, women can also present with quite swollen and bloated abdomens during their periods. The symptoms in general can be incredibly difficult to live with and very debilitating for a woman. And sometimes the symptoms are also outside of their periods, so that the pain and the cramping can continue. And that's something that a lot of women find very difficult to manage. Also, pain during sex is a common feature, or pain running down the legs, pain on urination, and also on defecation as well. So how does endometriosis occur? Well, no one really knows the answer to this. There's lots of different theories about it. One of the commonest is that some people believe this is due to what we call retrograde menstruation, or when blood happens to track upwards in the reproductive tract and can escape into the peritoneal space or the tummy area. And so pieces of tissue that are supposed to belong to the inside of the womb, the endometrium, can potentially escape and seed outside of it. This is one theory, but there isn't enough evidence to prove this. Another theory is that there's an immunological mechanism behind it, so it's something to do with your immunity, and that this defect in your immunity or something going on there could be giving rise to inflammation essentially within the pelvis. Again, something that's very difficult to prove, but lots of experts believe that potentially this could be a cause. And then there's also genetics. So some people believe that there is a genetic association as well, but again, insufficient evidence to prove it. Environmental factors are almost certainly important, but we don't really know what exactly they are. We do, however, know that exposure to certain chemicals or potential exposure to other hormones, other from our food or products that we use, could potentially flare up the endometriosis. And this is why removing certain things from the diet, so for example, dairy or gluten, might be helpful in some women with endometriosis, because it helps to reduce the degree of inflammation that's already there. Aside from the pain and the other uncomfortable symptoms that endometriosis produces, there are also concerns over how it can affect your fertility. Now, again, there isn't a consensus as to exactly why this is, and there are lots of different theories. Certainly, there could be some structural abnormalities in your pelvis that I'll talk about in a minute, which could affect your ability to get pregnant. But then there are other things which are a little bit more difficult to prove. So the effect on the eggs within the ovaries could be significant, and typically we do see that women with endometriosis could end up having eggs which are suboptimal in quality and aren't quite as good as they should be, or a lower number of eggs within their ovaries. There's also potentially some evidence that endometriosis, because of the inflammation that it causes, could affect the fallopian tubes, so could either give rise to some swelling on there and collections of fluid, pockets of fluid that can obstruct the fallopian tubes. And endometriosis could also possibly affect how the uterus or the womb is contracting. And this is important because that can also aid the sperm to swim up. And if these contractions are abnormal, it can have the opposite effect, so it could prevent sperm from reaching the eggs, or in fact could have a negative effect on implantation of the embryo. These contractions could be counterproductive or negative when it comes to that. Now, endometriosis, if it seeds outside of the uterus, can cause issues. So we've already spoken about the fallopian tubes, but it can also affect the ovaries, and women can get quite large cysts, what we call chocolate cysts or endometriomas, that can cause pain during a monthly cycle, or could in fact start to bleed, or worse still, could burst and spill all of their contents if they're large enough to do that. Now, sometimes they are insidious, and sometimes there isn't any association with pain. And actually, the bizarre thing about endometriosis is that the amount of pain that you're in doesn't necessarily correlate or relate to the amount or extent of endometriosis that you have. So this means that women who have mild endometriosis can sometimes have quite a lot of pain or severe symptoms, and vice versa, that women who have very severe endometriosis may not get a lot of pain at all. Endometriosis can also seed inside the uterine or womb muscle, and this is what we call adenomyosis. And there is an association between miscarriage or increased rate of miscarriage and extensive adenomyosis. But again, we don't quite understand how exactly to treat this condition and exactly what effects it might have. We do generally, though, as a group of clinicians, agree that if the endometriosis is extensive enough and causes symptoms, or a woman is struggling to get pregnant, then something does need to be done about it. But the question is whether to intervene medically or whether to do something surgical about it. The majority of medical management for endometriosis either involves taking the oral contraceptive pill, which of course is not an option for women who want to get pregnant, but otherwise it's inducing a chemical menopause, so giving you certain drugs in order to induce the menopause, reduce the amount of inflammation for a couple of months so that the endometriosis is diminished and we can go ahead and do an IVF procedure after that, or embryo implantation, in order to give it a greater chance of success. However, surgical management is sometimes an option, especially in a younger woman, and in particular if there are anatomical defects within the pelvis that are picked up on a scan or at laparoscopy, keyhole surgery. So this is where we intervene by actually resecting or cutting or burning the endometriosis, removing any cysts that are there, or trying to unblock the fallopian tubes, or potentially having to remove the fallopian tubes if they're badly scarred and damaged. Management for endometriosis is not straightforward at all, which you can see from what I'm talking to you about, and it's really important that any decisions which are made about it are made with a specialist and with a doctor, and sometimes with a multidisciplinary team as well, because your endometriosis could be affecting your bladder and bowel as well. And if any treatment is recommended for this, then almost certainly it's going to involve a group of specialists who also counsel you properly about the extent of the endometriosis and what effects it could have if treated surgically, and any risks that could be involved if that is done. So really important to have a really good workup and understanding of where you're at with the endometriosis, what symptoms or problems it's causing for you, and then making a decision by weighing everything up in terms of whether to intervene and how to do that. But there are some great options out there, and there are lots of women who do manage to conceive after managing their endometriosis. So please rest assured with that. If you are affected by endometriosis, the great thing is that there's loads of support out there from women who also suffer from the same condition, and other support groups who can offer you some counselling. It's really fantastic that it's out there, and because I feel really passionately about this subject and I understand how awful it is to live with this condition, I've also created a special forum on my website where there are guest blogs from women who help to run the support groups and who suffer from endometriosis themselves. And I'd encourage you to read that on my website to actually see and get an idea of how their experience may also help you, and any tips that they may also have to help you too. There's also some great counselling involved, and I really encourage you to make use of that and to go and see someone who's again had experience of managing patients with this condition. And please also tune in to the videos that I've made on clean eating and diet, as well as exercise and toxin-free living, which are so applicable to women who have endometriosis. And I really would love you to follow that advice and to try and adjust things around your house or in terms of what you're eating and the exercise that you're doing, and allow you the chance to have as pain-free a life as possible.